All right. Hello, everyone. My name is Meg Boyko. I am the Executive Director at the Teen Pregnancy and Prevention Partnership. And I am here today with Jessie Brown. Jessie is the Community Engagement Liaison with Behavioral Health Response. And so I have a couple questions for you, Jessie, because we are living in an unusual time with COVID-19 around us. And so considering that and that you work at the Behavioral Health Response, I was wondering, is it still important to get care? Like if you're having an issue or feel like your mental health is not where it should be, is now the right time to call and get help?
Yeah, absolutely. I think it may even be more important now because of what we've been going through. Over the last few months, there's been unprecedented levels of community trauma, grief, loss, stress, all of that stuff. And so, it's never, ever a bad idea to get a little extra support when you're dealing with some big stuff like that.
All right, so if someone feels like they need support, what should they do? Like, how would they get a visit, or how would they refer somebody for a visit or support if they needed it?
Yeah, so all you need to do is just give us a call. Our phone number is 1-800-811-4760, and we are available 24 hours a day, 7 days a week. And BHR covers St. Louis and then the surrounding counties in the state of Missouri. There are additional crisis lines available for the entire state, throughout the state. And so if you're not sure what crisis line covers your area, what you can do is go to the Missouri Department of Mental Health website, which is dmh.mo.gov. You'll want to click on the crisis assessment tab, and then from there you'll click on behavioral health crisis hotline. And you can search by your county and it'll pull the phone number right up for you. And so my suggestion is to get that phone number now. Put that in your phone, take a picture of it, write it down however you like to keep track of things. But do it now, because you never know when you might need it, or when a friend or a family member or maybe a neighbor might need it.
All right, so if someone gives you a call, what does that visit look like? Or do they have to schedule an additional visit? Is it in person, or is it just there on the phone? How does it all work?
Sure, yeah. Yeah, so there's no need to be in person for our services. Our services will begin when you give us a call to the crisis line. And like I said, 24/7, we're available for telephonic support. And it's important to keep in mind that crisis is different for everyone. So what I might think is a crisis might not be the same for you, and that's okay. And honestly, you don't even need to be in a crisis to give us a call. So there's really no wrong reason to call us. We have an outreach team, so if you're wanting to get set up with mental health services like counseling or psychiatry, our outreach team can set up a time to come and meet with you and do a crisis assessment and get you set up with those services. And usually our outreach team would come to your home or school, or meet with you in some other community space. But due to the pandemic, we've had to adjust that to maintain safety. And so now those are looking like Zoom meetings or maybe a more in-depth phone call. And so during a call to the crisis line or an outreach, we'll have an organic, really natural conversation with you, because we want to get to know you. We want to figure out what's going on and what's the best way that we can help. And then we also check in with everyone that we talk to about safety. And we'll discuss different ways that you can stay safe if you're having thoughts of suicide or self-injury. And like I said before, you don't have to be in crisis to give us a call. We've had lots and lots of phone calls where people just reach out to ask what kind of services are available to them in their area. We've got a humongous database full of resources that we are happy to share with you. We've also had people reach out to us because they're concerned about someone else, whether that's a family member or a friend or a coworker or someone that they know from social media. We are happy to have a collaborative conversation between you and the person that you're concerned about. And if you're not comfortable with that, or you don't want that person to know that you called, that's okay too. We can reach out directly to the person that you're concerned about, and have a conversation, check in, see what's going on, and how we can help. And so there's lots, like I said, lots and lots of reasons why people give us a call. And all of the reasons are valid. So some examples of why someone might call us, it might be someone that's having a panic attack, maybe needs a little bit of help with that. It might be someone who's just had a really tough day at work or at school and just needs a little bit of extra support. It could be someone that's having thoughts of suicide or self-injury. It could be someone who's worried about their family member and doesn't know what to do or how to help. It could be someone that's kind of dealing with a tough situation or needs to make a big decision. And again, they just need a little extra help with that or a little support with that. So no wrong reason to give us a call. Please reach out to us as much as you need. And then the last little bit of our services that we have is a follow-up team, which is really great because they're a team of people who will follow up with you post-crisis, post-outreach, just to keep checking in, see how you're doing, give you that extra support. But then they're also going to help advocate for you and make sure that those services, those resources that you were given during your initial call or the outreach are working out for you. And if they're not, they can get you some other ones, or they can even make some of those phone calls with you to get the services going. We like to think of ourselves as the community safety net, right? And so our ultimate goal is to help support the community and make sure that you are getting connected to the services that are going to be the most beneficial for you.
All right, that is a ton of good information. Super helpful to get someone started if they need to give you a call. So do you have any parting advice or words of wisdom for somebody who is thinking about these services or thinks they need to give BHR a call?
Yeah. So my advice would be, if you are thinking about giving us a call, to just do it. Give us a call. Even if you just want to know what it's going to be like or what, how is it going to go, that's okay. It's okay to try it out before you really feel comfortable talking about what's going on. We are all human and we all need support from time to time. And sometimes it's just easier to talk with someone that's not in your daily direct life, someone that's not going to judge you or go and talk about your business with other people. And so we're happy to help in whatever way you need, whatever way that we can. We want to make sure that you feel heard and valued and know that we care about you and that we want you to be here tomorrow.
Thanks, Jessie. That is a great message to hear. We appreciate you as well, and hope that people will give you a call now that they know a little bit more when they need your services. So I will talk to you again soon, but I appreciate your time and hope you have a great day.
Thank you, you too.